Hey, what's going on? This is Greg with sportsrehabexpert.com. Today we're going to be discussing pain that you might be getting behind your knee, limiting your ability to extend the knee, move the knee comfortably without any type of discomfort. Oftentimes when we talk about this pain, it's on the outside, posterior or behind the knee, but you could also be getting pain behind the knee on the inside as well too. Regardless of the location, our treatment, our plan of action is going to be very similar, and it's going to focus on what you can control, not focusing on other things that are out of your control, such as an image finding. Now, I've linked a video here. I'm showing you a video that I've done in the past as it relates to why I feel like imaging isn't that important, especially if you haven't had a specific trauma that you can associate your pain with. So if you are unclear about that thought process, be sure to watch this video that I'm showing you in the upper corner. Now, as I mentioned today, what we're going to be doing is focusing on what you can control, things you can get started with today to solve this problem. And the big thing you need to understand is the motions that are causing you problems. So generally this is extending the knee, but it could also be flexing and bending the knee as well too. When you fully bend the knee, you're going to compress this area. When you fully straighten your knee, you're going to fully stretch or put that muscle on tension. And likely one of those two positions, if not both of those positions, are going to be problematic for you. And what we need to do is reestablish the spectrum of movement capabilities inside the joint and inside the tissue, making sure the tissue quality has the ability to fully compress against each other and then elongate. So what we have to do is kind of work backwards from knowing that this is what the tissue needs to be able to accomplish. How do we start with what our current capabilities are and then progress towards this end goal of being able to achieve full range of motion back in the knee and develop resiliency in those muscles and tendons. Now, generally speaking, again, these people who have pain here are going to have issues straightening their knee more times than not, and oftentimes when you develop strength in the backside of your knee, then your knee is just more comfortable folding and compressing in that end range knee flexion. As you develop that capacity, generally that quality kind of restores itself on its own. So we're going to be focused more on restoring tissue qualities, tissue strength and resiliency, as well as the ability to withstand tension or elongation. Now, the muscles in question here are going to be your gastroc. The gastroc does go down towards the Achilles, but it also crosses the knee. And then you got the hamstring, which attaches up the hip, but then crosses down past the knee as well too. So these are the two big muscle groups that we're going to be discussing. There's some little smaller muscles around the knee joint, such as the popliteus, that you could also put in question here as well too. But it's important to remember that we don't need to be super specific on what we're trying to address. We just need to know the positions and the general muscle groups that are all going to be active. The big misnomer or misconception with a lot of fitness exercises is that you're always isolating a muscle. A lot of times there's very minimal isolation, and there's multiple muscle groups all working in conjunction with an activity, just on different levels of intensity based upon the spectrum and the position that you're working the muscle out in. First exercise we're going to be emphasizing is a calf raise. So a calf raise is very simple. The further you can go through a dorsiflex position or on a slant board, the more this is going to get a stretch at the gastroc up towards the knee joint. So working towards being able to get a full dorsiflex position with a calf raise is your goal, but you might have to start flat on the ground because that's your current capability of what you're comfortable with, and then progress towards a deeper and deeper ankle bend or a deeper and deeper stretch of the calf through that strengthening exercise. So we're working on range of motion, tension training, as well as building strength and resiliency simultaneously. Next up, we have the hamstring that we want to emphasize full range of motion, strength, and resiliency. Now, depending on your comfort with the exercise, you might have to start in positions that put less tension on the hamstring when the knee is fully extended. So a seated hamstring curl is going to emphasize more of a knee bend, whereas a standing hamstring curl or a prone, laying on your stomach hamstring curl is going to put more tension on that distal or hamstring as it crosses the knee joint at that very end range of motion. So A lot of times seated is more comfortable of a starting position for people, and then they work towards a standing version, or a prone version would be the hardest, where you're really trying to control that last little bit of extension in the hamstring. But again, you only load it to a point that's comfortable for you to do on a regular basis. 2 to 3 times a week we're looking at loading these structures if you're dealing with pain. So if you can't load it that frequently, then you need to change a different exercise. You need to swap exercises out with one that you can do more frequently, or you need to decrease the load to make it comfortable to allow you to load it at that frequency. Now finally, when you progress through all of those things, we can challenge the self further with other exercises such as a stability ball hamstring curl. Again, really emphasizing that knee straight portion where we really emphasize that distal hamstring as it crosses the knee, or getting to the hardest exercise, which would be a glute ham raise or a Nordic hamstring curl would be the hardest. And again, we need to emphasize getting all the way down as low as we can, because the further we work towards that knee straight position, the more capacity we're going to develop in that tendon. But again, we can't work through pain, and if you can't do it on a 2 to 3 time week frequency basis, it's probably too strenuous of an exercise for you to do currently, or you need to reduce the load again to allow you to do it at that frequency. Okay, so right now you have 2 movements. There's multiple exercise options within those 2 movements to emphasize, but you have 2 movements. One is bottom up with the calf raise, with the knee straight, and another is top down with the hamstring, working towards getting that knee to fully extend with the hamstring curl. Now, one other way of looking at this is tension training. So putting that knee on as much tension as we possibly can tolerate comfortably, again, to fully, again, allow that backside aspect of the knee to fully elongate to help with knee extension. So we've developed resiliency and capacity in the tendon, which is goal number 1. Something that you want to establish from day 1 is where you currently are capable of loading and progress from there. But then finally, we also want to establish comfort with that tension, that knee in full extension. So a couple different options you have here are elephant walks and Jefferson curls on a slant board. These 2 exercises allow you to gradually load the knee in a more extended position, and you get that eccentric kind of elongation of those muscles to allow tolerance and loading under full length. Now this can be somewhat provocative, so load modestly. Make sure that this again is comfortable for you to do on a 2 to 3 time a week basis. If it is not, then you need to reduce the intensity of which you do the exercise, the load, or the range of motion that you are currently doing that exercise under. So there's always modifiables within these exercises, and that's the key, is that you can scale these exercises to your current comfort to allow you an entry point of loading and establishing range of motion, and then you gradually progress from there. Now, if you're dealing with this issue currently and you need a little bit more guidance than what this video provides, we have a couple options at Sports Rehab Expert. You can get help from me one-on-one personally. We'll set up a Zoom call and we'll go through these different movements as well as others to help you along this process. We also have a done-for-you system or a workout that involves 4 phases. This is called the 0-week links workout. I'm available to answer questions within that workout frame, but that's more of a generalized workout program. If you want something more specific, then we'll set up that Zoom call, that one-on-one connection. Alright, so I hope you found this video useful. Be sure to like, subscribe, and share the channels with others if you found this valuable to you. And appreciate you watching the video. We'll be back at it next time. Drop some comments below with some other videos that you'd like to see.